Can use of earbud and sharp foreign objects lead to the middle ear infection? Today I am going to bust the myths and misconception about the middle ear infection, and myself Dr. Ravinder Gera, Director and Head, Max Hospital, Gurugram. See, most of the middle ear infections can be treated with antibiotics, but not all the cases should be treated with antibiotics. Some kind of serious middle ear infections can be treated with just with the local antibiotic drops and the anti-allergics. Most of the ear infections, they are not the bacterial in origins. So only the infections which are bacterial in origin should be treated with the antibiotics, and other infections can be treated with the local applications of the ear drops, ointments, and in some cases if we are not able to treat the infections, we have to do sometimes surgeries to avoid the complications. So putting cottons, earbuds and other things can irritate the skin and the membrane of the tympanic membrane and can lead to the middle ear infections and external auditory canal infections. Prolonged exposure to water, swimming, these can lead to the external auditory canal infections if you don't know that sports in a very good way. So if you are swimming and water goes into your the external auditory canal, it can lead to fungal infection that is called otomycosis, and for that you should consult a ENT doctor, get it clean and get it checked and have the proper treatment. Particularly the patients who are diabetic, they are more prone to infection of the external auditory canal, middle ear, or sometimes the inner ear infections. Because if the blood sugar level are raised, there are chances, there is a propensity to develop the malignant otitis externa, which is a very bad infection of the external auditory canal. So these kind of infections should be treated at the earliest with the IV antibiotics. If not, then sometimes the surgery is the answer in cases of malignant otitis externa. If sometime the middle ear infections which are unsafe in origins, like if the bone eroding disease is there, that is called unsafe CSM, can lead to infection in the brain and the inner ear nerves, that is called labyrinthitis and meningitis, and such patient should be treated urgently by admitting the patient in a hospital, do proper evaluation, and after that, if required, if surgery is the treatment of choice, try to do the surgery at the earliest so as to avoid further damage. If there is an infection of the external auditory canal, most of the infection can be treated with the local treatment or by giving the antibiotics. If there is an involvement of the drum, if the drum is perforated because of the disease, then we need to do the surgery. We have to repair the drum so that the subsequent infection stops. And if there is a bone eroding disease that is called as the unsafe CSM, then those cases should be treated on an urgent basis. Surgery should be done at the earliest to avoid further complication. Not all the cases leads to mortality, but patients like who are highly diabetic, having malignant otitis externa, and if this disease spreads into the skull base, can lead to mortality. And similarly, if the unsafe middle ear infections goes into the brain and into the inner ear, sometime leads to, if not treated at the earliest, sometime can lead to mortality. Child who is having recurrent upper airways infections, they spreads directly into the ear, can lead to otitis media, acute otitis media, and chronic suppurative otitis media. So any child who is having recurrent URI should be properly investigated and should be properly evaluated by an ENT doctor. Acute, maybe the external ear infection or the middle ear infection leads to fever, but cold is not the symptoms of the ear infection. In fact, the cold and cough can lead to the middle ear infection. If there is a long-standing middle ear infection, can lead to damage to the tympanic membrane, can damage the ossicles of the middle ear and can lead to hearing loss. So such patient should be operated as and when the need arises. So my message, clear message is, be careful, don't use earbuds, don't use sharp foreign objects. So if you are having any kind of middle ear infection, best thing is to consult a ENT doctor and get it checked. Thank you.